My name is Matz, and I'm a reconstructive urologist here at Erlanger. I work on urologic conditions where some process, whether that be cancer or trauma, has caused a problem, and then I help to put things back in order. So one of the things that we're really passionate about in reconstructive urology is dealing with urethral strictures, getting them completely solved with one procedure. We have a couple of new technologies for that. We have a drug-coated dilation balloon that we can use on folks with urethral strictures. But if that doesn't work, we have open surgeries essentially that fix the urethra so that folks who were being managed with multiple trips to the hospital, multiple dilations of the urethra, can now be managed with just one surgery. The post-cancer and cancer survivorship patients tend to just want to get back to where they were before. And while we can't get everybody perfect, we can often regain some of that function. And those patients tend to be pretty open about their issues. They've been through a lot already. I'm usually the last stop on their train. And so for those patients, I think we have a lot that we can do to help, and I think there's a lot of people walking around thinking, hey, this is just my new normal. And for those patients, we want them to know we can help, we can fix things. Maybe it's surgery, maybe it's not. Maybe it's just a round of physical therapy or an injection that can help restore some sort of function. For our folks who are non-cancer folks, like those who've had trauma, or those who may have diseases from skin problems. For those folks, I want you to know that when you come to see me, we've seen it all before. It's all normal. I know that folks who come see urologists who come see me have seen a lot of people before and have gotten a lot of wishy-washy answers. And so when you finally get to see me, I want people to be at ease, to know that we've seen it before, and if there's something out there to fix it, we'll be able to offer it for you.